Hello, hello.
Hi, Dr. Bright.
Hi, how are you?
I'm good. How are you?
I'm fine, thank you. Hi, Bo. Hi.
This,
Hi.
this is Lady Dora. She's our first lady in one of our churches in Texas. So
Oh, okay.
yeah,
Nice to
thank you
Yes.
so much. We really appreciate you honoring our invitation, and we are excited for you to be here with us this morning. Well, at least morning here in America.
Yeah, yeah. I'm happy to be here too.
Yeah, thank you. I really enjoy reading your work, and I appreciate all the work that you have in your book. So,
Thank you. Well, you have to get the second one now
yeah,
because yeah.
yes, I have an 8-year old, so a 9-year old. She just turned 9, so
Yeah, well, oh, it's all for all women, really. It's
yes,
just I have to title it that way because it's talking about younger stages of women's life. So
yeah,
it's not, I don't expect adolescents to read it. I expect the parents to read it.
yes.
And
Yes, for sure. So let's get started. Hi,
sure.
everybody. Welcome back to the channel. Thank you so much for joining us today. Today we have a special guest with us. This is Dr. Elizabeth Bright. She's an American naturopath and osteopath. She's currently practicing in Italy right now, and she is the author of Good Fat is Good for Women Menopause, and also Good Fat is Good for Girls Puberty and Adolescence. So welcome, Dr. Bright. We are happy
Thank you.
to have you here once more. So Dr. Bright, can you please introduce yourself to our audience here?
Yeah, well, actually not practicing in Italy anymore. I'm
Oh,
practicing online only because during
oh,
COVID, we had to close. I had osteopathically, I had to close the studio because, well, during COVID, we weren't allowed to treat people with our hands.
oh,
So yeah, and I'm an osteopath and naturopath. I specialize in thyroid and adrenal function. I use the high-fat carnivore diet as a treatment modality. Naturopathy and osteopathy both, the meaning of these disciplines is that we remove obstacles to healing. So I don't medicines medicines are trying to change something that the body is trying to say, and instead osteopathy and naturopathy bring the body back to healing by removing obstacles to healing.
oh, thank you. Thank you for that. So I want to start with your book, this one. And in there, when I was reading it, this goes against the mainstream advice on the advice we are given.
Sure.
Yes,
Mm.
especially for women's health and even menopause. It goes through it. So, what made you write this book?
Because of that, because when I became menopausal, I saw the negative descriptions of menopause. So I didn't feel that way, and it didn't make sense to me. So I just dug down and did the research and found that it was actually not at all true. Menopause is true. It exists, it happens, but it happens because that is how we live longer. That is how we become grandmothers and carry our grandchildren to the hunting grounds that, women have a storage of knowledge. So,
Oh,
it was actually invented, menopause, the bad part of menopause was invented by pharmaceutical companies and by society.
wow. And with the egg, it's interesting because you know what we are told about eggs and the yolk.
Yes,
So
yes.
why why is fat good for women?
Because all our hormones are made out of fat. So if we supposedly are running out of hormones, we don't run out of hormones when we go into menopause. We just stop bleeding. So we still have, there are three types of estrogens. We have a deficiency in one, and that is for a purpose. We're not supposed to get pregnant. So the deficiency in one means that we will not get pregnant and we will be able to, because pregnancy is very nutritionally expensive. Chimpanzees, for instance, don't have menopause. They die at 50 because they don't have menopause. So we are the very lucky humans, whales. There's only a few very like maybe count on our hands species that actually go into menopause, and that's a positive it's a positive evolution.
Wow. Okay. Well, good. And also when it comes to fat, we have monounsaturated fat,
Yeah.
polyunsaturated fat, saturated fat,
Hmm.
and trans fat. So can you explain some of them and which ones of these fats are good or are better for us human bodies for
Well,
our
yeah, saturated fat is what is good for us if it's from animals. So cholesterol is actually the only fat that's good for us. Polyunsaturated and monounsaturated is olive oil and things like that. Polyunsaturated are vegetable oils. These are terrible. These are seed oils. These are terrible for us. Trans fats are horrible for us. The only fat that's good for us is saturated fat. You cannot make hormones out of olive oil. You cannot make hormones out of peanut oil. Our brain is restored with saturated fat. The nerve tissue is covered with myelin sheaths. They're all made out of lipids. They're all made out of saturated fat. So that's why we're supposed to eat it.
Oh, okay. So speaking of saturated fat, when it comes to the saturated fat, there's a concern with, high LDL and high total cholesterol. And for me, when I did the carnivore diet, I did a high fat carnivore diet. I felt so good. I healed a lot of inflammation. My period, which was surprise to me, got so much better. I had like terrible menstrual period with a lot of pain. And since I was 11, I've been having it, and I had to take ibuprofen, to manage my pain constantly. And I
Mm-hmm.
went on the carnivore diet with high fats, high saturated fat, and I tell you, the pain is gone. Like no pain
Yeah, of
at all.
course.
So everything was good. And then I got my lab because I just wanted to make sure that, that is also good. And all my markers, my cholesterol panels were excellent, except for my total cholesterol and my LDL, which was elevated. So
Mm-hmm.
is this a good thing? Why does that happen? And then is it a good thing? Is it safe for us to have higher total cholesterol and LDLs if all our markers are okay?
Well, the thing is that cholesterol in the 1950s, Ansel Keys basically invented the fear of cholesterol. And at the same time, there was a doctor named John Yudkin who talked about how sugar was bad. And both scientists were saying that, well, the Ansel Keys was the American, President Eisenhower had heart disease, and they were all trying to figure out, oh, how can we stop heart disease? And this Ansel Keys did he did a study called the Seven Countries Study, and a lot of his work was falsified to make it seem as if animal fat, the people who ate animal fat didn't had more heart disease than people who did, which it turned out wasn't true at all. He falsified his research. At the same time, John Yudkin published a book called Pure White and Deadly to prove that it was actually the sugar that caused the heart disease. And this is the issue. The cholesterol is not the issue. Now, unfortunately, everybody's told to buy a lot of statins, to take statins. And 10 years ago, the high marker, as high as it should be to be healthy, was 300.
Mm,
Now then it was 280. Then it was 220, and now it's 200. And now they're going to try to get it down, I've heard, to 180. This is the only way you can have 180 or 200 and be healthy, a level of cholesterol, is if you're vegan or you're taking statins.
yeah.
So, unfortunately, the fact is that we do need saturated fat. Now, there is something as too high cholesterol. One of the old ways of diagnosing hypothyroidism was high cholesterol. So, if your cholesterol is 450, it's not because you have familial hypercholesterolemia, it's because you are hypothyroid.
Mm,
So the best thing to do would be not be hypothyroid. But I think a woman has to be between 200 and 280 to be healthy, to make hormones, to make brain tissue, to address stress. That's fine. Mine is 288 and my triglycerides are 83. So the triglycerides need to be low. The cholesterol has to have that range.
mm. Okay, thank you for that. Um, And then when it comes to consuming the saturated fat and protein, I think you hit a little bit on this. There's a lot of concern about heart disease and
Mhm.
also kidney disease. Can you
Mhm.
speak on those for us?
Yeah, kidney disease is not caused by protein. So unfortunately, that came from a bunch of studies done on bodybuilders who were, when bodybuilders go do their competitions, they eat a lot of protein isolates. They drink these drinks with protein powders, right? And this quantity of fake protein, it's not even real protein. It was every other nutritional part of food was taken away from that. And that quantity of protein came back in these couple of studies showed to be hard on the kidneys. That's all that was taken from. There seems to be sort of a worldwide push to make people stop eating meat. Does protein does not cause kidney disease. Sugar causes kidney disease, absolutely. You can have fatty liver disease because of high sugar intake, lots of fructose, honey, fructose products. That just doesn't even, that's really bad for the liver.
Thank you
I'm
for
sorry, the kidneys. Yeah, we were talking, I went into the liver, sorry, but also the kidneys. We've seen a ketosis. There was a study that actually demonstrated a kidneys that were diabetic for that glycation happens when there's a lot of sugar. When you have insulin resistance, there's a lot of sugar in your blood, right? That damages tissues. And they restored a kidney from a diabetic by having that person be in ketosis. And that means no sugar. The sugar was removed from their diet and the kidney healed.
wow.
Kidneys, yes.
That's amazing. And speaking of protein, actually, can you actually tell the speak on the difference between animal protein and plant protein? Because a lot of times, the plant protein are promoted as a healthy
Yeah.
protein for us to consume. So what is the difference and which one is better for us?
The animal protein is better for us. Plant protein is marginally, doesn't have all each animal protein has a wide spectrum of amino acids. So our body is needs all these different kinds of amino acids, taurine, cysteine, they're all in these packages of animal protein. The plant proteins it's not real protein. They just sort of are molecules that are similar and they don't have any fat. So animal protein is a package that has protein that your body can actually build something with. You can't build muscle out of plant protein. You can only build it out of animal protein because that's what our muscles are built out of.
Wow, thank you so much. Ms. Dora, please can you ask the next question for me?
All right, thank you so much, Dr. Beth. So I just want to know that do we need carbohydrates at all? And if we do, how much carbohydrates do we need? The reason I ask is, just trying these different diets, the carnivorous diet and all these things. I realized, I was telling Sandra that I was losing a lot of weight, and that was not my goal.
Mhm,
I felt like I was at a healthy weight, but
mhm.
then I realized that, okay, I'm losing too much weight, which was of a concern to me because I stopped all the carbohydrates. So just want to know how much carbohydrates do we need, or do we even need it at all? And if not, I mean, if we continue on this diet, are we just going to, I guess, lose weight until we turn into bones, or what is what?
No, no, we don't need carbohydrate. Absolutely not. Our liver makes sugar, makes all the sugar we need. The tiny, tiny amount that our brain needs to kickstart something is made in the liver every day, all when we need it via gluconeogenesis. You may not have eaten enough fat. So if you don't eat enough fat, if you're eating only protein and you're avoiding fat, you might lose a lot of weight.
Okay, so what would be the source of the fat?
Well,
What?
you may have to add, so the body can only make energy out of two things. It can make energy out of sugar or it can make energy out of fat. sugar energy is glycolysis, and fat energy is ketosis. But if you're not eating enough fat, you'll be starting to eat your own protein, as it were, because your body will use it to make energy, because the sugar, the protein will turn into sugar. It won't turn into fat, it'll turn into sugar. So probably you weren't eating enough fat, which would mean that if you were having sirloin steak and fish, there's not enough fat there. You have to add fat. You have to add butter or add tallow, or, for women, for men, they can get away with big pieces of ribeye, which has ribeye is one of the cuts that has the most fat on it. But women can't really, they need to add fat. And fish, forget it. There's no fat in fish. Salmon has a fatty skin, but that's all. There's not enough fat for you to use to turn into ketones.
And can I just add a follow-up with that? Because I've recently gained weight on my diet, and at first I went through the same thing that she went through, that I lost weight. And but now I realize, I don't know if I'm overeating from my protein, and I'm not being as active as I was when I first started. So I'm actually currently, like, just last week I was checking my weight. I'm like, I'm up on weight. So does it have to be, is it the protein? Do you have to eat enough protein to balance with the fat, or which one have to be more?
Fat has to be more, because you're making energy out of fat. If
Okay.
you eat too much protein, it'll turn into sugar.
Oh,
So but every metabolism is different, and we can't just look at how much this is and how much that is. There's a lot of hormone stuff going on too. So, the stress needs fat. We address all our cortisol levels are made out of cholesterol, so you need fat to address stress. I don't know, it may not just be how much fat and how much protein. We want to get to the point that we just wake up in the morning and say, oh, I want this with my fat, or I want more meat today, as our day needs, as our stress levels indicate. That's what, I mean, I don't count what I eat. I just eat what I feel like eating, but I only eat meat, and I only eat butter, and I only eat tallow. That's all I eat.
okay. And then with the fat, I just just ask this also. Does it make a difference between, like, the intake of dietary cholesterol, like as in the egg yolk, and does it have an influence on our total cholesterol?
Okay, so an egg yolk is half protein and half cholesterol. It's very little cholesterol in an egg yolk. That's just
Because we're told to
that's
always take the
propaganda.
yolk out.
I know what we're told. I know what we're told, but that's not true. There's very little. There's more cholesterol, obviously, in a tablespoon of butter than there is in a yolk, which is like a tablespoon. So, but what was the question though about the? Oh, does it add to our dietary cholesterol? It's you can get these apps that say how much, I do it for my patients, how much for their height, for, they need I put people on an 80-20 ratio. So most women need to start, if but they come to me with issues, right? They're not 100% feeling great. I fix stuff with an 80-20 ratio of 80% fat, 20% protein. So that usually looks like about, I don't know, a pound of beef and a stick of butter for somebody who's my height, 5'7". It'll be different for somebody who's different height, or somebody who's incredibly active, does a lot of weight training. It might be different for them. But in the beginning, to fix cortisol levels and reduce inflammation, that works.
Okay. So it's just individual basis.
Absolutely, yeah.
Okay. And then how does fat helps to reduce the cortisol level to help us to reduce stress?
Because it scientifically does. So they had elite athletes, just a recent research paper, elite athletes, when you're being athletic, when you're running, right, or you're bike riding 100 miles, you're using your cortisol. Whenever your heart rate is high for 15 minutes, you go into a stress state. So your body thinks, I have to run. I have to run because there's danger. So what happens? Your liver makes sugar. So it goes to your muscles. So you have the energy to run. So all this stuff happens physiologically when you're exercising because your body thinks it's in danger. So cortisol levels go up because it thinks you're in danger. So the elite athletes who ate fat after their exercise activity, they measured their cortisol levels. The ones who ate a high fat diet, their cortisol went down. So their inflammation went down. Their cortisol levels, the stress response returned to normal. So they de-stressed faster and better than the people who ate a normal diet,
Oh,
whatever, standard American diet.
thank you for that. And then can you explain how fat helps with weight loss? Because I try to tell people you need more fat. And they're like, oh, I'm gonna gain weight. Like fat don't make you gain weight, it's the carbs. So can you just explain why fat can help with weight loss?
Well, they're probably thinking the calories, and that those calorie tests were silly. They had a guy sit in this little bubble thing, and they weighed how much he would eat, and then they would weigh his sweat. I mean, all kinds of weird ways that the calorimeter or whatever it was called back in the 1800s. It's not a good way to calories in and calories out is not very scientific. One person can react very differently to the same amount of calories because of their endocrine system. If they have a lot of stress, if they, very stressed, even people with a lot of stress can act differently. Two different people can have a lot of stress. One person will lose weight and the other one will gain weight. So it's very, very complicated and different for everybody. The reason why you lose weight when you're in ketosis is because you're able to, if you take out carbohydrates, your body is going to use your own fat for energy. And that's what being in ketosis is. So if you're eating 80-20, 80% fat, 20% protein, you'll be in ketosis. There's no carbs coming in for your body to say, oh, maybe I'll use that for energy. There's only the fat that you're eating plus your own fat. Now, you might think, oh, if I eat the fat, I won't burn my own fat. It doesn't work that way. Your body has to get into the groove of burning fat. So you got to eat the fat in order for it to get in the groove of burning your own fat.
Oh, okay. Now I understand that concept because if people who need to lose weight, and it's like if they can use their own fat to lose weight, but their body don't know how to use the fat to burn the fat
Right,
yet, so
right,
they have to
right.
consume the fat so that it can help their body to learn how to burn fat in order to burn their own fat to lose the weight.
Right,
Okay.
right. But you can also have a situation where somebody will gain weight temporarily because they're so ill, their body is saying, whoa, now we finally have what we need. Let's keep it, like when you're a kid and you get something and you want to hide it from somebody because you don't want anybody else to have it. You hold on to it, this nutrition that you go on a carnivore diet and you gain 5 pounds because your body says, oh, they've been giving me crap for all this time. They were vegan for all this time. I just got to hold on to this nutrition just in case tomorrow they decide to go vegan again.
Okay.
That's temporary. The body has to balance out.
Okay. Well, thank you for that understanding. Because our in our culture, we eat a lot of carbohydrate, like starchy carbohydrates. So
Mhm.
if somebody like that is to go from that high starchy carbs into like a carnivore, it would be it would be a struggle, I could assume, just because of that amount. So what is something that can help? And then also, what are some of the effects of eating such starchy carbs on our
Mhm.
health?
Well, heart disease, diabetes, those are the results of eating starchy carbs. We know that that's the result. Why are rates of heart disease and diabetes getting higher and higher and higher as we are eating more and more carbs and eating less and less meat? Um, I mean, I live in Italy, so everybody's eating carbs around me. They go to the pharmacy and they come back with, piles like this of medication. They have hypertension medication, they have statins, they have, everything out there and they're all they're all eating that way. So we know that the carnivore diet with adequate fat reduces inflammation. It's seen scientifically. We've seen it. There's studies that show this. If you reduce inflammation, you're reducing the stress on the body. You're reducing oxidative stress. So you're preventing the body from having to make you sick. Because any sickness, any illness, any dysfunction in the body is just it saying there's something wrong here. Fix it. So it may be difficult to switch because you're on a blood sugar roller coaster. If you've been eating Hostess Twinkies all day, or potatoes, or cookie biscuits. My grandmother made the best biscuits, all that kind of stuff. If you're eating that every day and you all of a sudden don't eat it, your body says, where's the energy coming from? And you feel horrible. So you can't just eat meat, because remember, the meat is kind of on the fence. It's not really energy. It's sort of sugar. It's muscles. If you don't add the fat, it's very easy to make the switch if you do it high fat, because you're taking away the energy, you're adding a different energy.
Thank you so much for that. Lady Dora, can you do the next set of questions?
Yeah, just want to find out what you would consider the optimal, what you consider a superfood that will promote optimal health. Because I know you keep mentioning eat the fat, add the fat, and I'm just trying to, because just sitting there and chewing butter, I mean, I tried, I couldn't do it. I just can't eat butter or even
Mhm.
put tea, and it's so. I mean, what other ways? Can you?
Ribeye. Eat meat, eat fatty meat. Beef ribs are very fatty. The best, the superfood is animals that eat grass, because they are eating everything that's in the grass, and we're getting it from them. There's no omega-6 in that. Chickens are carnivores. They're supposed to eat worms, but what do they get? They get corn. Pigs are carnivores too. What do they get? They get slop and corn again, grain. That makes their flesh have a higher level of omega-6, which we know is inflammatory. So the superfood would be lamb, goat, bison, beef. That's the superfood.
Mm.
And just to add to that question, because a lot of people also have concerns with this, is it okay to eat like a grain-fed cow versus a grass-finished cow? Is there
Yeah,
just
they
because?
eat. No. They eat grass all their lives except for the last month. So, you don't have to spend the big bucks on the grass fed. It's a tiny amount. That tiny amount of higher omega-6 from the 1 or 2 months that cow ate grain, but it's only a little bit of grain. They're still eating grass. They're still eating hops and a mix of things. Peter Ballerstadt has done very good reports on that. Has still less omega-6 than chicken or pork.
Okay, go ahead, Lady Dora.
Right. So how does our diet affect brain function and mental health?
Oh, huge. The brain's made out of fat. It's all made out of fat, but saturated fat. It's not made out of trans fats or polyunsaturated fat. Mood swings, any kind of mental health disorder is going to be affected by your blood sugar. So irregular blood sugar is affected by stress, but also by how much sugar you're eating. If you're eating a high-fat carnivore diet, you'll have a stable mood. Sandra, did you notice more of a stable mood when you?
Yes.
Yeah.
Yes, and
So it's
I
very, very
yeah.
important.
Yeah, and anxiety just came. I didn't even know I had anxiety, but with
Mhm.
that, I was just like, wow, yeah, I don't feel anxious about things. So I did experience that.
Yeah, stable blood sugar.
And just on that note with mental health, nowadays we see a lot of developmental delays in kids and
Mhm.
autism. Does this have anything to do with the diet we are consuming?
Yes, and also iodine deficiency, which is what my second book is about. Women who don't have enough iodine in the womb, the children, the fetus will not have enough iodine, will not have enough thyroid, and that causes learning disabilities and autism.
Wow. Wow. So even for kids, is it safe, especially kids with delays or autism, is it safe for them to be eating a high fat?
Sh- Sure. But there's no iodine in the food, though, unfortunately. There's so many substances that interfere with the absorption of iodine. I make sure people eat a mostly meat and higher fat diet and also take some iodine, which I've done a few videos about, which it's an essential nutrient that unfortunately today is not available. Not enough of it is in our food because there's so many. Fluoride, for instance, prevents the absorption of iodine. Tea has a lot of fluoride in it, and that would prevent the absorption of iodine, which would mean that thyroid function would be damaged.
Wow. And just on the mental health thing, I've seen some studies with folate and dairy and how dairy can prevent the absorption of folate, especially in kids. Is that true? And then should kids not consume as much dairy, or is it raw dairy versus ultra processed dairy?
Okay, so folate was invented in 1941. It's not even an essential nutrient. They folate from folio from spinach leaf. Now, how that came about is because they were trying to help pregnant women who could not afford to eat meat. Initially, this started in India. They had no access to meat, and the babies were born with spina bifida. The neural tube was not formed properly. So they first started with liver extract, and that boom, that healed. The women no longer had issues, and the babies were born just fine. That's also in my second book. A particular scientist did a lot of research on this, and then they found out that B12. She started using Marmite, which is this like yeast stuff made that the Australians like. B12 is in nutritional yeast, and that helped too. And she always said that the liver extract was better, but it was cheaper to use the B12 from the yeast. And then this was in the 30s. And then in 1941, I don't remember his name anymore, he isolated folate from the spinach leaf, and that worked too.
Wow.
But my contention is, so now people are being tested for folate, but they should just be eating meat. They wouldn't need the folate if they ate the meat. And you can often see on laboratory reports B12/folate. So you don't need the folate, you need the B12. Now dairy, we humans did not evolve to eat dairy. It's it's not it's not a superfood. It's not something that is, it actually has, there's a book called The Devil in Dairy, 2 tablespoons of milk, cow dairy. There's a slight difference with sheep and goat. 2 tablespoons of cow milk has a quantity, an opiate quantity in it because of the casomorphines, the proteins in milk, which is why people have, you were asking me about in the email about lactose intolerance. It's more the intolerance to the casomorphine. It's more the intolerance to the protein in the milk that causes issues. So raw milk still has the same quantity of protein. The enzymes that the not pasteurizing the milk saves does not remove the protein, which can be inflammatory. So I don't recommend dairy. I recommend butter, which has a teeny tiny amount of milk protein, but doesn't usually cause any issues. There's a paper called Bread and Milk, the Edible Agents of Disease, which has discussed how removing bread because of the gluten and milk because of the casomorphines healed schizophrenia.
Wow, that's amazing. Okay, go ahead, Lady Dora.
Yeah, so I mean, obviously, whether we like it or not, we will age. It's part of life. So as we are aging and definitely will one day approach menopause, what would be the advice as far as taking care of our bodies are concerned?
I'm 61 and I go out on the sea
Oh,
paddleboarding. I did 8K today on my paddleboard. And then I work for the rest of the day very hard. Um, do what I did. I turned 52. I went into menopause and I was already eating a ketogenic diet, but then I just got rid of all the plants and had no issues. And that's what my book is about. How to women have issues because they've been avoiding fat for so long. Since adolescence, we've all been avoiding fat. We all wanted to be thin and look like so-and-so, and we stopped. I did it, stopped eating fat, which is what we need to have a healthy life. So when you get to menopause and if you have issues, it's that you didn't eat the fat for 20, 30 years before. So you can fix those issues by eating the fat.
all right. So, I mean, based on what you're saying, so should we just balance things out where maybe just a little bit of carbohydrates, or are we saying cut it totally, like no carbohydrates at all?
If you have issues, you have to cut it totally. If you have a little bit of issue, maybe you can have a little bit of a carbohydrate. I mean, I have patients who add some back occasionally. I can have an ice cream once a month. I had a headache the last time I did it, but very rarely do I do this because I never want to get Alzheimer's and I want to be very healthy and I want to go paddleboarding on the sea 8K and have that energy at my age. So your question really has to be, what do you want out of life?
Hmm. Okay, because I do ask that is because I'm thinking, what if you don't have any issues? Because prior to even starting the carnivore diet, I was telling Sandra, I thank God I didn't have any inflammation issues. I've never had any of that, never struggled with weight or whatsoever. So I was wondering, what is my goal in here? Am I just doing it because people are doing it? Then I realize I'm losing weight. I'm like, wait a minute, this is not my goal. I don't want to lose weight. Thank God I don't have that problem. So I just want to figure out just how to stay healthy, basically. So I'm just wondering whether if nothing is happening, do I still keep a little bit of carbohydrates and eat more fat? Or with that little carbohydrate in the food, will it still cause any damage at all?
It really depends on your starting point. I mean,
Okay.
we know carbohydrates are unnecessary. It's entertainment. If you do have health issues, you need to remove it. There are plenty of things you need to remove if you have, I mean, you have to stop drinking tea. You have to stop having mint. Plants are poisonous. So we can, all we need as humans is meat. So, or fish, whatever, animal fat and animal protein. Um, you can be very healthy. If you haven't eaten horribly, if you weren't vegan and
Mhm.
you have been eating continuously some meat and some fat and maybe a little bit of carbohydrate all your life, you should be okay because you have, as you said, balance. But if you've been eating mostly French fries, which are fried in seed oils, and only chicken, which doesn't have chicken breast, which has no fat, yeah, you're gonna have some problems.
Gotcha. So is there a certain vitamin or nutrient you consider someone to take on a daily basis? Because I know these days we have a lot of vitamins, on the shelves. Is it necessary?
No, because if you're eating a carnivore diet, no, because everything's in meat. So your fat soluble vitamins, your vitamin D, your vitamin K, your vitamin E, they're all in the butter and the meat, the fat that's in the meat. Okay. All the other, the zinc, the magnesium, everything else, the B12 is in the meat. So if you're eating that, you don't need all those vitamins, but you do need iodine because there's not enough iodine, but you don't need all the supplements. So basically all supplements were invented for people who couldn't afford to eat meat.
Hmm. Okay.
Wow.
Yeah. And if we're on such a diet, do you still have to work out?
Exercising doesn't save anybody's life. So diet and exercise is the fallacy that came in the 1950s when they told us to stop eating meat. Everybody used to just work. When you worked, that was working out because you worked, you were moving your body, you were lifting things, you were doing things, right? So nobody talked about exercise because you were working. I believe that walking is great. I think weight training is great, but you don't have to force yourself. You have to like it. It has to be fun. And it's, mobility is important. I mean, muscle is good because if you fall, you're not going to break. If you have muscle, you're less likely to fall. You want to be able to be agile so you can play with your grandkids and run for the bus, whatever. That's what exercise gives you, but it shouldn't be done to the point where you think, got to be on the treadmill, or I'm, got to do these steps, do these numbers. That's not fun. That's not right.
Mm, mm. I had a question coming again. They wanted to know, what is the effect of combining animal fat and then plant fat? Like if somebody's eating butter and avocado, like, is there any?
Okay, so the worst thing would be fat and carbohydrates, because then you have the Randall effect, because then the body's very confused and it doesn't understand, do I burn this sugar or do I burn this fat? Nothing gets burnt, right? So that can cause inflammation. I don't think some avocado is going to do a ton of damage if you're also eating, animal fat. But I wouldn't be eating 10 avocados and 1 teaspoon of butter. It should be the other way around.
Okay. And another person asks, how do you address inflammation and joint pain at a nutritional level?
Carnivore diet, high fat, absolutely.
And Lady Doe, I don't know if you have these are new questions
Yeah.
that they were sent to
No,
me.
I mean, I have one that
Okay, go ahead.
I think it has to do with the first question you had asked about the cholesterol, because it's just hard when you go do your blood work and of course all your numbers check out and you see that high cholesterol number.
Mhm.
It is scary because doing this carnivore diet,
Mhm.
where we're eating all these fatty meats, and sometimes I'm feeling guilty when I'm sitting there eating all these meat. I'm like, oh my gosh, I don't know, but then you look at the numbers as Sandra was talking about, and when you look at your cholesterol, overall cholesterol is like 300.
Mhm.
I mean, how is that okay though?
Well, if it's over 300, it's probably because there's a thyroid issue. Maybe add some iodine. Humans evolved to eat meat. So whatever problem, the whole cholesterol thing was invented, as I said, in the 1950s. It didn't exist before. The worry about cholesterol did not exist before, and people ate mostly meat. And they definitely ate fat. So you have to inform yourself. You have to read the papers. You have to read the books that show that protein does not cause kidney disease, that there's absolutely no association with colon cancer and eating meat. These are all lies. They're lies, because the meat in that paper was a hamburger with the special sauce and the bun. So it was mostly carbohydrate. So you have to question authority. You have to question, why are they saying this to you? Why are they saying, who's making the money? Follow the money.
Well, thank you. I mean,
You're welcome.
I think for us too, our diet is like, when it comes to fat and meat, it's our diet, when we have a plate, is full of like 75% carbs, like rice, and then like one chicken drum, and then and yeah, that's the only fat and protein that we get. So that's the culture that we come from. So the idea of eating meat and fat to some people is like
Yeah, but
she
it's so
said,
recent. It's
yeah.
so recent. If you look at the plate from the 1940s, it was mostly meat and a little bit of it was fat, meat. It was a round plate, and each section was the same. They've changed it. They've changed it for a reason. They used to make people eat during the war. They wanted people to eat more. Meat was rationed because the soldiers were supposed to get it, because what does meat do? It makes you strong, makes you survive. So you have to really think that what they're telling us in 2024, why are they telling us? And you have to look at history. You have to look at health history. You have to see, I mean, you can't just look at, the doctor, why is he saying that? What they were trained to tell you that? Why were they trained to tell you that? I mean, it's the same with thyroid function. People aren't looking, I send my patients to test their thyroid levels, and doctors refuse. They don't want to address it. And there are reasons for this.
Mm.
So, it's, you have to sort of question, as I said, authority.
Yeah.
And look at other countries, look at places where they don't eat the way people eat in America now. Look at their rates of, heart disease and diabetes. China, for instance, there was no diabetes in China until China opened up and everybody started selling stuff there and they started eating sugar. They never had sugar. I lived there in the 80s. No sugar, no diabetes.
Mhm. Yeah, it's amazing why, like, just like you said, about 50 years ago, since then they've been telling us, oh, eat complex carbohydrate, the whole grain, and people are getting sicker and sicker and sicker. There's more metabolic disease today than there
Mhm.
have ever been. And this
Yes.
is not just in, adults or, people in 50s, 60s. This is like even in kids.
Absolutely.
And
The highest rate of juvenile diabetes is in southern Italy, where I live. And the kids on the beach are fat. So if you look at pictures, photos of people 20, 30 years ago, nobody was fat.
Mhm.
It was
Yeah.
rare to see that person. So what has changed? That should be the question. That should be the answer. That's right there. We have to believe with our eyes.
Yeah, so that is really interesting. One question is here that they sent here. What do you consider healthy levels of estrogen and progesterone for women in their middle ages?
I don't. I don't care. I don't make them measure it. Thyroid rules how your estrogen and progesterone. They're going to be told if they measure, they're going to be told that I don't believe in HRT because if your endocrine system is working well, your body says, okay, I'm going to make this much estrogen out of the fat you're eating, and I'm going to make this much progesterone out of the fat you're eating.
And then there's a question on thyroid. So, are there things women let's see. Are there things we as women should do to prevent thyroid disease? I think maybe.
Take iodine. Take iodine, Lugol's iodine. You can get it at Amazon or elsewhere. Don't drink tea. There are plenty of things you shouldn't eat. That's all in my new book. I'm sorry, but they prevent the absorption of iodine. Oatmeal, oats prevents the absorption of iodine. What does thyroid need to make hormone? Iodine. You're not getting any iodine if you're eating sweet potatoes, oats, millet, quinoa, I don't know how to pronounce it. Black tea, green tea, matcha, lemon balm, quercetin, a popular supplement. All these things make you hypothyroid because you can't get the iodine in.
Wow. That is that is so amazing with that. I I strongly suggest everybody need to get a copy of this book. You know what surprised me when I read this at the end, you actually give like a menu, and I was like, oh wow, I was not expecting that. Like what you can eat for breakfast, lunch, or dinner. So I think this book is great. And your next book, I'm gonna read that because I have 3 girls, and the first lady has 2 girls. So we're gonna get it and get them started early. Because
That's
I've
great.
noticed now in kids, we are getting, kids are maturing earlier and earlier.
Yes, that's what it's about. That's what
Yeah,
it's about.
because
Precocious puberty.
the people were like, kids were not hitting puberty until like 14, 16, but now it's like
Yeah.
9, 8. And
Right.
so, um,
That's
yeah, I'm
it's the
definitely,
carbs.
hmm.
Yeah.
So I hope everybody have learned from this interview. Um, we have to cut the carbs. If you don't reduce it, just cut it. And it has saved I've seen a difference in my life and in my health. And so I'm hoping that we can transfer this to the next generation. Because what I've also noticed at the stores is that these carbs are not just like even single whole ingredient carbs. Now everything is, in the box, the cereals, and then they add the sugars and the sprinkles, and it's so many stuff, so many chemicals just to preserve it, and it's not good for our health. It's not even food anymore. So it's like, what is
Right.
food? And so we really need to take this serious and use this in our health, to get better health, because whatever health that we receive, we pass it on to our kids and they pass it on. And
Mhm.
I love the story you tell about your mom at the beginning, and how, you know, during her generation, that's when the whole stop eating fat started.
Yeah.
And then she ended up, if you can share that story with us.
Well, she had Alzheimer's and she died 2 years ago, and it was very, very sad. And my grandfather also had Alzheimer's, and literally I talk about how both that's her generation and even my grandparents. I remember, they started using Crisco because Crisco was sold as being easier and better because we all fall for advertising, and they stopped making their biscuits with butter or lard, which is what they should have been making their biscuits out of. So those are the seed oils and those are very inflammatory. So yeah, that's one of the main reasons why I continue. I have 3 kids and a grandchild, and I want to be around to play with them and the other ones that are coming. So that's why I eat this way.
Thank you so much. But I just want, I don't know if Lady Dora have any last minute questions or anything.
I think it's been very educative, and I do agree that for the carbs, as much as we can, to cut it out of our diet. I guess for me, the struggle was just knowing what fat to eat, what fat to add on. Because I would tell Sandra all the time, I can't see myself just sitting here and just chewing butter, and just eating butter.
You can do beef fat trimmings and pork belly fat. Those
Yeah,
are
yeah.
very fatty.
That's true. That's true. There are many choices.
Yeah, so if the butter is, not everybody likes the butter.
No, not
So
everybody does.
I'm going to get a book and I'm going to try the menu on the back, and hopefully,
Thank you.
yeah, hopefully I don't lose any more weight, but I just maintain it and just stay healthy. So thank you so much for honoring this.
Thank you.
Yes.
Very nice to meet you both.
nice to meet you, Dr. Bright. We really appreciate your time. God richly bless you. And where can we find you?
My website, elizbright.com.
Okay, I'll leave that in the comments. And then also you have a YouTube channel. I think I've
Yes, it's also, all the videos are on the website too. So it's all there, the books.
Yes, okay. So
Right.
look for Elizabeth Bright and get her book, and her second book, Good Fat is Good for Girls. Please get it, especially if you have daughters. And then let's get healthy together as a community and pass it on to the next generation. Dr. Bright, thank you so much again for this.
Welcome.
And
Thank you for having me.
you're welcome. And the African community appreciate you so much for this. So keep on doing the work that you're doing. You're making a life difference for many generations. So
That means a lot to me, and that's why I'm doing it. So thank you very much.
thank you again.
Have a good day.
Too.
Bye.
Bye.
Bye-bye. Bye.